Hello everyone. Let's talk about hormone-induced hair loss, what we call androgenic alopecia. Now, whether it's men or women, both have two areas of their scalp. One is called balding scalp, the other one is non-balding scalp, or temporary zone and permanent zone. What is the major difference between these two areas? The follicles in balding scalp, there are cells called sebocytes, the oil secreting cells. It is in these cells that the testosterone is converted to its more potent part, which is called the dihydrotestosterone, and this happens by an enzyme called 5-alpha reductase. Now this dihydrotestosterone goes and sits on a receptor or like a socket in the wall, and you assume this DHT to be a plug. So this receptor in the balding scalp, this is called androgen receptors, it is more sensitive in the follicles of balding scalp versus non-balding scalp. So this is why everybody under hormonal influence tends to lose, or the hair starts to become thin more in the front of the scalp than the sides and the back. So the sides and the back is the non-balding or the permanent area, and the top and the front is the balding scalp. So when someone presents with a hormonal induced hair loss, first the two different categories, one is a pattern loss, the other one is a diffuse loss. Pattern loss follows a specific pattern and there are grades of it, so it starts from either temporal angle and slowly goes back, or it starts from the vertex. Now when it's a diffuse pattern, it means that you have hair everywhere, but then in somewhere it's thicker than the other. Now the diffuse pattern also can follow some sort of a pattern when it's called diffuse pattern, or it can be affecting every follicles in the scalp irrespective of whether it's a balding or non-balding scalp. Why this difference is essential is because if you have a diffuse unpatterned loss, then you may not be a right candidate for what we call hair transplant, because hair transplant is based on the principle that we redistribute follicles from the non-balding area to the balding area. So you need to have non-balding area and not something that is affecting diffusely. Now the other thing that you need to know is in those who have diffuse pattern, they will not become completely bald. So there will be thinning in the balding area, but it may not become completely bald. So you are better off taking some medical treatment, first assessing the progress and then planning on a hair transplant. Hair transplant is mainly meant for those who have a pattern androgenic alopecia, where the entire balding area can be affected, but the non-balding follicles always remain strong. But one thing you need to understand is, even after the transplant, when the follicles are transplanted from the non-balding area to the balding area, if there is some concerns in the skin, if the DHT in the balding scalp is high, over a period of time, still those follicles tend to miniaturize or shrink. So this is why you would see that after hair transplant, some of them who follow regular medical protocols on and off have good density and diameter of hair throughout their life, whereas some who do after transplant think they don't need to take anything and stop all medical treatment, they end up having thinner follicles over a period of time. So these are some important points that you need to know if you are facing what is called hormone-induced hair loss or androgenic alopecia.